Part of a Champion Day is where we provide sports physicals for high school athletes at no charge. We partner with high schools in certain school districts, so only the schools that we partner with are actually invited to our event. Our physicals include, height, weight, vision check, blood pressure screen. We do a musculoskeletal screen. They get an EKG, and they see a sports doctor. And I think that's what makes our physicals a little bit unique, is because they're seeing a sports provider. All the athletic trainers are working these events. They're working obviously at the schools. So yeah, if there is a need, if a kid has to do a vision recheck or a blood pressure recheck, they can easily do that at school.
So an EKG is a test where we measure the electrical signals coming from the heart with several stickers on the chest.
And essentially what we're trying to do is make sure that all these student athletes down here have a heart that's going to support them as well as it can during the activities that they look to pursue.
It's important to have a cardiologist read these EKGs, because one of the downsides of doing a test like that is you can get what we call false positives, where it's flagged and it's actually a normal variant, especially for a teenage athlete. The flip side of that would be a false negative.
Some of the things that we might find are just things that need a little bit more investigation. And so in those cases, we would have them come to our pediatric cardiology clinic in the Children's Hospital so we could do that further evaluation, whether it's an ultrasound of the heart or a stress test or an MRI, to make sure we understand as much as we can.
I think parents are just really appreciative, of the services that we're providing, and we have a bunch of volunteers, a bunch of doctors here, and I think they just really appreciate that someone's taking the time to do that for their child and make sure that they're safe.